for myself, it was like all this, from the getting the diagnosis through to getting the operation done, it was all just 100 miles an hour. It just seemed to run away with itself. And then all of a sudden, I had these when I was convalescing and getting better and healing. I had this sort of like 3-4 months of not having much to do, and having lots of time to think. And all of a sudden, it hit me like a brick wall, what had happened. And I went into depression. I went into a bit of depression and anxiety, almost like I suppose PTSD. Would you say? Something. It was a little bit. One of the big things was triggering me was I had all the pamphlets and booklets and everything like that next to my bed.
Right.
Beforehand, I'd been reading to get myself up to, genned up to what was going to happen, what was going on. But then at the end of it, I had this period of time where when I saw that, it was taking my breath away. It was like, oh my goodness, I've just been through this. What do you do to really deal with that at the end of the process?
Yeah, I think that's a really common experience, is that, when you're getting diagnosed, it is almost like this roller coaster. You just go so fast, and then so many people I've spoken to in the past say it's like getting spat out at the end. Okay, you're treated now, you're done. And then because you don't have stuff to do, it does kind of hit you full whack sometimes. I would say that if you're noticing symptoms of trauma, because a lot of people do experience it as a trauma, it's life-threatening.
Yes.
And it happens very quickly, and it's done to you. So things like noticing very high anxiety, finding that you're quite jumpy, we'd say that's hypervigilant, getting nightmares or intrusive thoughts about what's happened, that can indicate that you have some trauma symptoms. Now, using things like relaxation is very good to help with that. Trying to get to see a psychologist or a counselor, because they can help to talk through what it is that's happened. Our minds can get a bit stuck in trauma, and sort of go over and over and over, which is why you feel like you can't break away from it. But there are some things that we call grounding techniques, which can help to pull you out of that. And it can be as simple as looking around the room and labeling 5 things that you see, or feeling a texture that's like really soft or prickly, something that you can really focus and hone in on. Using your 5 senses is a really good way of sort of punching through that anxiety, just because it's a bit of a brain hack, essentially. When we've been through trauma or a significant adjustment, our mind is in like this fight flight mode. And so it's going to be going over the stuff that's really scary, and anything that is a reminder, like those leaflets you said, can really trigger that immediate response of, oh, my heart's racing, I'm breathing quickly, and it's that, oh, that thing was life-threatening, that was scary, we need to avoid that. So doing something that's going to calm down the body can really help in those situations. But I would say anybody who's feeling like those symptoms are quite strong, quite regular, then go and speak to your team or your local mental health service to see if you can actually get some counselling and therapy for it.